Welcome to week 11 of our lecture on personality theory. I hope you are enjoying the Easter season and I hope you are back to work. This week we'll be talking about assessment in special populations. When we talk about special populations, we're talking about children, adolescents, couples, and clergy. And we are going to be considering the ethical and developmental consideration under this. It's not going to be a full lecture, it's just an overview to help your reading. Now, looking at the assessment, it's not a one size fits all process. Special population requires context sensitive, developmentally appropriate, and ethically grounded approach. Okay, I say it again. Special population, as listed above, requires context sensitive, developmentally appropriate, and of course, ethical grounded approach or approaches. This population presents unique developmental stage, unique relational dynamics, unique power structure, unique cultural and spiritual dimensions. Okay, and that calls for carefulness when we are dealing with this population. Now, looking at the core principles of assessment across special populations, what are the core principles of assessment across special populations? Number one, developmental sensitivity. Developmental sensitivity is one core principle of assessment. Assessment must align with cognitive, emotional, and social development. Number two, contextual awareness. Contextual awareness, like family systems, culture, spirituality, and environment shape presentation. Okay. And number three, relational dynamics, particularly important in couples and clergy context. Relational dynamics, because as a couple, we need good relationship with people, and as couple, we need as clergy will deal with people. So, okay, so and number four or five, ethical responsibility. So we must be guided by principles such as informed consent, confidentiality, competence, and non-maleficence. That is, you mean no evil. Let's look at assessment of children. What are the key characteristics? Number one, limited verbal expression, concrete thinking, dependence on caregiver. These are the key characteristics: limited verbal expression, concrete thinking, dependence on caregivers. Let's look at assessment method. Now, one of the way to assess children is to play therapy. Play therapy. Okay. Two, behavioral observation, parental and teacher reports, standardized tool, which must be age appropriate. Now, looking at the key focus area, developmental milestone, attachment patterns, emotional regulations, and family dynamics. Those are areas to check. Developmental milestone, attachment pattern, emotional regulation, and family dynamics. These are very important. When it comes to ethical considerations, we're talking about dual consent. The child and the parent must consent. Okay. And confidentiality limits with parents too. Whatever the child confided in you, you don't tell the parent. And you need to avoid suggestibility too. Okay. And when it comes to assessment of adolescents, the key characteristics there are identity formation, increased autonomy, emotional variability. These are key characteristics. And this is linked to developmental psychology. All right. So the assessment method, you're talking about clinical interviews, you're talking about self-report measure, we are talking about risk assessment. Okay. The key focus area now is another one which must be identity and self-concept. Identity and self-concept, peer relationship, risk behaviors, so as substance use or impulsivity, mood and anxiety, concerns. The ethical consideration there also involve confidentiality or parental involvement, managing disclosure, especially when it involves risk behavior, building trust with collusion. Okay, these are things we need to look into. When assessing the couples, the key characteristics are joint interviews, individual sessions, observation analysis of interaction. That's Those are characteristics. And the area to focus, communication styles, emotional responsiveness, conflict resolution patterns, and power and control dynamics. We need to check all this. The theoretical framework, often informed by systems approaches, such as family system theory, FST. Okay. And when it comes to ethical considerations, you know, managing secrets, no secret policy versus confidentiality boundaries. Okay. Another one is neutrality and avoiding alliance bias. Another one is screening for domestic violence. This is very critical. When it comes to clergy, you know, assessment of clergy, unique context. Clergy operates at the intersection of spiritual leadership, public visibility, and the personal vulnerability. That's their unique context. Okay, it's spiritual. They are public figures and they are also vulnerable. So, common presenting issue are burnout and compassion fatigue, role overload, moral injury, boundary challenges. These are the common presenting issues. And how do we assess them? Is narrative and pastoral identity exploration, stress and burnout inventory, and spiritual assessment tools. We have all those things to measure what they are going through. So the key focus area are role expectations versus personal identity, spiritual well-being, support system, boundary, and self-care. Those are key areas. And in doing that, we need to avoid dual relationship. We need to respect their theological worldview and avoid spiritual bypass. Very important. So, ethical consideration across all populations. One, informed consent. I've talked about this before. Two, confidentiality. Three, competence. Four, risk management. Okay. And when you are dealing with developmental consideration, there's cognitive development influenced by stages, such as Piaget's theory of cognitive development. We talk about psychosocial development, guided by the framework of like Erikson stage of psychosocial development. The implications of that assessment is that children, the concrete play based, adolescent identity focused, and adult relational and role based. This we need to understand. And when it comes to cultural and spiritual sensitive assessments, must account for cultural background, faith traditions, and community expectation, particularly critical in clergy assessment, where spiritual identity is central. Let's look at the common pitfalls in assessment. Common pitfalls. There are five of that. Over reliance on standardized tools, ignoring developmental stage, failing to assess context. It's a challenge. Ethical blind spot, especially confidentiality issues. We have to be careful of that and misinterpreting culturally normative behavior. Okay. The best practices are use of multi-method assessment. You're using interview, you're using observation, and you're using other tools. You engage collateral information when appropriate. You maintain reflective practice. Reflective practice. This is very important. Reflective practice and supervision. And you prioritize client dignity and autonomy, which is very important. And document carefully and ethically. Let me round off with this that assessment in special population requires a balance of science, sensitivity, and ethical integrity. Effective clinicians adapt their methods, respect developmental realities, and navigate ethical complexity wisely. Ultimately, assessment is not merely about diagnosis, it's about understanding presence in context. All right. At the beginning of this lecture, I called it personality theory, but I think this is more of assessment. That's another course. It's assessment. It's psychological assessment course. All right. So take care, everyone, and I will talk to you again. Take care.